Welcome to Dear Doctor with Avon HMO.
Yeah, I'm Dr. Akinkunmi Lori, the head of Provider Relationship Management at Avon HMO, and I'm here to answer some of the questions you've been asking us on social media. So I know a lot of us don't even know the difference between an STD and an STI. It's a very common question that I get. So STD basically is sexually transmitted disease, while STI means sexually transmitted infection. So in some parts of the world, these two acronyms are used interchangeably, but they don't actually mean the same thing. You know, a disease is a disease, an infection is an infection. So I'll explain it this way. So you can get infected with a virus without having any symptoms. So when you have symptoms associated with this infection, that's when it becomes a disease. So an infection plus symptoms becomes a disease. And you all know the symptoms of STDs can range from pain while urinating, discharge from the vagina or from the penis, abdominal pain, and the likes. So that's just to explain it in a very simple form. Infection is when you get the virus in your body, and then the disease is when the symptom comes with it. How often should I get tested for STIs? I just got into a serious relationship and my partner suggested I get tested before we get intimate. So it is advised that you should get tested for STIs at least once in a year. However, if you have multiple sexual partners, you should get tested about 2 or 3 times a year. Apart from that, if you're an intravenous drug user, you should also get tested more than once a year. I heard that you may have an STD and not know. Is it true that some STDs have no symptoms at all? Yes, that is very correct. Some STDs actually do not have symptoms. Examples of these STDs that do not have symptoms are gonorrhea, chlamydia, herpes, human papilloma virus, and the likes. You know, they have symptoms rarely, but most of the time, 9 times out of 10, these will not have any symptoms, but you can still pass on the infection from one person to another, even if you don't have symptoms. If I receive treatment for an STD, does that mean I can't catch it again in the future? You definitely can catch it again in the future. If you've had an STD before and you still engage in the same sexual practices you've been having in the past, you definitely will have an STD again. It's just like malaria. If you treat malaria, if you get bitten by a mosquito again, definitely you're going to get malaria again. So that's exactly how it works. Are all cold sores caused by an STD? I know people are always afraid when they get sores on their mouth, even if they are malaria blisters. You should know that not all cold sores are caused by STDs. There are certain sores that can come on your mouth that are not caused by STDs, that are caused by other things. So you can have genital sores, which are caused by herpes simplex virus, and you can also have oral sores as well. However, you can actually get an STD from an oral sore through oral sex. So very important. Those of you that engage in oral sex, be very careful. My vaginal discharge is a different color than normal. Does that mean I have an STD? You have to be aware that normal discharge is usually whitish or slightly yellow. When you're having a discharge that is grayish, that is greenish, or very dark, it shows that you probably have an STI and you need to be treated. But please make sure that you get the right treatment if you get tested for an STI. Can STDs be transmitted through oral sex? Also, does being on the pill protect me from STDs? Definitely, STDs can be caused by oral sex because if you have skin-to-skin contact, that can also cause STIs. So you have to be very, very careful. Very, very careful. Oral sex is very predominant right now in our environment, so you have to be careful that when you do this, make sure that person does not have any sores around the oral area or around the genital area. If you're on the pill, that doesn't prevent you from getting STIs. So ladies, your hormonal pills and all that, it doesn't stop STIs, okay? Be very careful. I'm experiencing pain during sex. Does that mean I have an STD? Now, pain during sex can be due to a lot of factors, including STDs. STDs can actually cause that, but there are other things that can cause pain during sex. Pain during sex is actually called dyspareunia. That's the medical word. But there are other things like anatomical abnormalities of the vaginal canal and other things like that. Other infections that are not STIs can actually cause that. I see bumps down there. How do I know if it's just an ingrown hair or something serious like herpes? So really, usually when you finish shaving, you get bumps. So a clue to letting you know if it's an STI or it's just a normal bump. It happens, if it's just a normal bump, it will usually happen just right after you finish shaving, and it can also happen just during shaving. However, for STI, for a bump that is caused by an STI, it's irrespective of whether you have shaved or not, it can still happen. So that's very, very important difference. And also for a bump in the genital area due to STI, it's usually fluid filled. So when you bust it, some sort of yellowish fluid comes out. That doesn't happen on a normal bump. So that's a clear difference between the two. Does having another STI place a person at greater risk of catching HIV? Definitely. If you have an STI, you can also catch HIV. The means of catching HIV and the means of having an STI are pretty similar. So if you're engaging in similar sexual activities that had you getting the STI in the first place, can also cause HIV. So you have to be very, very careful. Avoid multiple sexual partners, avoid intravenous drug use and the likes. Who is more at risk of becoming infected with an STI? Men or women? Now, this is a very interesting question, and a lot of people ask this question. I get this a lot. So women are more at risk of getting STIs than men, and this is very simple. Why? Because the woman's vaginal area has more fluid attached to it, and also the urinary tract of the woman is also short, so infection can pass through easily, and also the fact that there is a larger surface area of the vaginal canal for women, so that's why they get it more easily. But guys, that doesn't mean that you should engage in multiple sexual partners or practices, because you definitely can get STI. And that brings us to the end of this episode of Dear Doctor. If you have any health-related questions, drop us a comment. Make sure to like and subscribe. And you can go to our social media handles at Avon HMO on Instagram, Facebook, and Twitter. And we'll be sure to answer all your questions on our next episode. Bye-bye.